Anani.
Here.
Roger Schmidt.
Here.
Nicole Cohen.
Here.
Pat Rooney.
Here.
Navarrete.
Here. And please stand for pledge of allegiance. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Please remain standing for a moment of silence. Thank you. Could I get a motion, please, to review and accept the agenda for this session?
I move that we review and accept the agenda as presented.
Second. Gary?
Pat Rooney.
Yes.
Nicole Cohen.
Yes.
Roger Schmidt.
Yes.
Nancy Anani.
Yes.
Joe Navarrete.
Yes. Okay, so this meeting is for the annual update on the Lake Havasu Unified School District Employee Benefit Trust, and we're happy to have our trustees with us. And I'm going to introduce the president of the trust, Cindy Ross. There you go.
Glad everyone was able to attend, and I think we're just ready to get right into it. And Ross Hobday is going to be making our first presentation.
Hello, my name is Ross Hobday. I was a board member from 2006 to forever, but I think it was 2014. I was actually on the board when we had, and I was on the trust before we had the center and after we had the center. I think you're going to the first line, please. Okay, so I'm not going to go line for line, but these are the things I, as a board member, had at my disposal at the time in 2012 when we went this direction. As a business owner and being self-employed and for paying for insurance for 55 employees for a very long time, over 30 years, the trouble that we had in the private sector was controlling costs. We couldn't control them because we didn't control our health care. We could control it by going out to bid every year, and we did go out to every bid. We had increases from anywhere from 20% to 100%. For 55 employees. So what we started doing to make it affordable and to keep it was we started getting larger deductibles, and we started dropping dental, vision care, and all this other kind of stuff. So at the end, we were paying more when I sold the business than we were actually at the beginning for half the care. At the time, I don't like anything that's in red in parentheses on a spreadsheet. So when I look at stuff, reduced administrative expenses, the network selection here in Lake Havasu is a very unusual place for healthcare because you don't have any choices. There's no, it's very basic, single hospital. We don't have any big carriers out here. It's really tough if you're a private citizen and or a large group to get a carrier. I sold my business this year in February, and Praxair does not have Blue Cross Blue Shield. They have Aetna. Well, I didn't realize that it doesn't do all that much for me. So all the doctors that I had for the last 25 years can't go to anymore. So because the carrier is different. Reduction of insurance tax at 2.5. The reduction of insurance company profits, which we were. I looked at it this way. If an employee goes to the doctor's office, the doctor obviously has to make a living. So there's a markup on that. Just like if you come to my store, I'm not giving you the stuff for what I paid for it. Everyone has to make a living. So that controlled cost is really what I looked at as recouping. At the time when we were doing this, I hate to say it, I didn't so much worry about the employee's health care. I wasn't receiving the health care. And I was looking at it as, what am I doing with public money? I, as a board member, don't have access to any health care, so I'm a neutral observer. I don't get paid for being on the board. I don't get the insurance. So what best fit for Lake Havasu Unified School District? So for me at the time, with the information that we had, I was not at the beginning for this. After learning about it, and this took about 3 years, after seeing it, I saw a way that we, as local controls, Lake Havasu Unified, and the city could control our health care by owning our health care. Meaning to the fact that we were in charge of it, we directed where it went and how we did it. When we built the center on the thing, the first thing I asked Missy and everyone was, what was our return on spending our investment? In the private sector, I only buy something if I can get my money back in 5 years, possibly 3, as much I'd much rather see it at that. So the numbers came back between 3 and 5 years that we were going to get our money back on the expenditures going into the building. That was something that I could live with as a businessman. So I thought, you know, this is no different than something I would do. And I asked Joe at the time, is always trying to work every angle, as if, you know, there's somehow we could get our businesses in there, or, you know, or would the city join, or what could we do to get expenses down? More the merrier, like any group. The local control for me was the biggest thing. At the time, Obamacare and things like this were coming online, and I was very concerned. I don't like to push stuff off. We are a very conservative community. So the last thing I wanted to do was talk a bunch of smack about how we were going to save money and then put everyone on the exchange, or push them on to the Affordable Health Care Act, not knowing any direction that it was going to go. I felt irresponsible at the time when I made my decision. So for me, after 3 years of talking about it, after going to many meetings about it, after seeing all the stuff, researching about how larger companies are going to healthcare, the teacher being on-site healthcare big companies are going to, because it's a selfish reason. You come to work, you see the doctor at the plant, and you're from there onto your shift. So to be honest with you, filling teachers back in their thing was big for me. An employee out sick, I still have to pay the employee. I have to hire a substitute. So now I'm paying someone twice. So these are things at the time that I looked at that were very important to me to keep our costs down. It wasn't just the expenditure of healthcare. It's a larger thing than that. It's retention. It's keeping teachers in their position and controlling costs. So when we talk about this, healthcare nowadays in our country is a very hot topic because it's not very good. I'm a firm believer that as a country, we don't take care of our children, we don't take care of our elderly very well, but we do everything in the middle, and the people in the middle pay for everything. I do think, though, you can't just have a blind free, everything falls out of the sky. Those days in the 60s when I was a kid, and you went to the doctor and it was free. I never saw a bill until I had to actually pay it when I became a young adult. So this is the information that I had at the time when I made my decision on the board. Retention became a big thing because back then, 2006 to 2014 were the dark years, to tell you the truth, because the district had absolutely no money. Anything I could do to save money, to keep a teacher's job, I would basically do. I'm a guy that looks at everything in a box. I save $20 here, I can spend it over here. It was important to me to keep teachers, because without them, what good is the school? I believe in teachers over buildings and everything else, because without you, I simply have nothing. Next slide, please. So here's what the information I had from 2006. I was actually here, so 2007, 8, all the way up. I left in 2014. As you can see, we held our costs for a very long time, and the employee, the spouse, the child, the +2, and everything on the total right-hand side of the slide, you can see how that side is actually escalated. For example, right now, I work for a very large company, and my health care runs me about $17,000 a year. Now, I do get a pre-tax, so it comes off, so I'm saving about 35% on top of that. But it is, when I retire in July, I, as an individual, have to come up with this money, and it's going to be about $19,000. My health care is going to go way down. So I might be a bus driver or something, because it's a pretty sweet deal. And the kids would hate me. But it would be fun. So I think the one thing, if I had a redo, when I was on the board, and not so much on the board, but the thing, I would have said that in 2008 to 2014, I would have said we should have brought it up 5% a year. Now, hindsight's always 20/20, so it's really easy to say, oh, shoulda, woulda, coulda, I wasn't here, what the hell's wrong with you guys, why didn't you do this? Well, at the time, 5% meant a teacher would leave the district because they had never had an increase, so if I raised their insurance 5%, it was just right off the top. So 5% a year for 5 years, do the math, pretty soon the teacher would have been making 25% less, just on a round number, and it wouldn't have been free. So kind of suck it up that right there, but I think ultimately if I had to do over again, I probably would have said, you know, we have to do something because sooner or later we're going to pay for it. Now I do think, as anything, work in progress. So I think the most dangerous thing is to make any rash decision at any time. If you look up there on the top, you see that it's for health, life, dental, drugs, vision, and employee assistance program. What became very big for me during this time, even I realized, having healthcare with my own people, was if I didn't keep them healthy, it got really expensive on the end. So in the private world, if I had one person that had huge claims, my renewal, I could go up 45, 50% from one individual. Which, if it wasn't morally wrong and against the law, if I fired their ass, so I could get my health care down. But it's wrong, and it's against the law. But this is why people don't have health insurance anymore in small businesses and stuff like this, because they simply cannot afford it. So, when you look at stuff like this, it looks very expensive, but when you're paying for it, I basically give anything if I get buy-in. Now, there's things that I think that the new school board, the insurance committee and stuff, there's always something to tweak. It's a never-ending thing. If you don't keep your people healthy, so much like a WOW program, you're going to pay for it in the end. It's no different than if someone is on high blood pressure medicine and you don't catch it and they drop and have a heart attack. The impact to you as a general population is huge. Weight gain, alcoholism, drug abuse, all this kind of stuff is very costly on the other side if you don't catch it. Is it any of our business what anyone does? No, it's not. But as a group, you all will be paying for it if it's not caught early. This is just the direction healthcare is going. So for some unknown reason to me, I ended up on the hospital board here in town, which is a scary thought all by itself. And I can tell you right now, the medical industry doesn't want you to have this because you're saving money and you're not going there. So to me, by taking the middleman out, it's all about control. Being in business, I believed in owning my destiny. I bought the property. I bought all the inventory. I owned everything. I controlled the direction that I went. Whether it was up or down, left or right, I had the control. No one got to tell me what to do. Except for my wife, and she's not here, so it doesn't really matter. But the most important thing on this whole thing when I was on the board was the control of the asset, the control of the program. You can plus and minus benefits, you can do all kinds of stuff, but if you don't own it, you simply can't do any of it.
I'm a 2-year employee. I've been here in 2015, 2016, 2016, 2017, where it's always been, fairly high. What is it that we are doing differently? I mean, I see from 2008 to 2014 that everything was fairly stagnant. And what is it that changed that path?
I think to a certain degree, and I would really like Dave to possibly address some of that, but I think we kept it stagnant.
And
My
why can't we
own
do that
personal
now?
view is we kept it stagnant under a false pretense. Nothing stays the same.
Well, we know that because insurance is always on the rise.
Right.
So what is it that
During
we
those
wrong?
times, we, as a board, for the 8 years that I were on, we were like, if I raise this, every teacher came and said, I will simply leave the district. Because I can't afford increases.
But it's a surprise. And
Well, it's not.
would
Well,
it have happened?
I don't know. I mean, you can always play and
It's a threat. I mean, really, where else are we going to go?
there's.
I mean, we have
All over the
husbands
country.
who have small businesses that can't.
I know.
So
let's just say that-
stay here.
We hire 60 new people a year. So maybe it was, and actually I've seen it higher, maybe 120 or 85, Pat, or something, Joe? Yeah, I mean, I've seen it double the number.
But I still don't understand, why is it why, what is it that we did wrong? I still haven't got my.
I don't think you did anything wrong.
Is it
I mean,
because
as
of
a
the
whole.
lanes? Is that?
Well, I think you
I
can
know,
have,
I need to, I wanna know. I mean,
you can
it's
have really
very
high
sad.
claims. So from the outside, that number is really low. I'd buy it today.
Okay,
But because it kept down so low for so long, you've had it almost double since 2014 to 2016,
And how long have we had the clinic?
2012.
So 2012 to current.
So really, in all reality, I don't believe the clinic is.
I just don't understand how it's doubled from within 1 year, 2 years. I'm completely shocked.
I mean, I'm not.
Whereas years in the past,
All right, let me just jump in here for a second. First of all, if you look at nationally, what's happened to health care costs is astronomical. It's going up, up, up. And as a business owner, I mean, I owned a business, I had 55 employees. I want to tell you that every year we went out for bid, and every year I was looking at 10, 15. 1 year it was a 30% increase in health care costs. For us to keep our rate where it was is unheard of, number one. And part of that was because we were able to keep our costs down, but part of it was a philosophical decision of the governing board, because we looked at it and said, you know, here we are not able to give our staff increases because of all the cuts and everything that was going on in education at the time. And we're looking at that saying, how in good conscience can we increase what's going to be out of pocket for them on, you know, without it affecting what's going to happen with our retention and recruitment of teachers. It is impossible. I mean, you know, because they would be in essence taking a cut in pay because their take home would be less.
yeah.
And so we were not willing to do that. So we kept it, you know, it's not to say that we were running in the red, we weren't. And had we not had a couple of years of really high claims, that increase wouldn't have been where it is. It would have been an increase, but not that much.
Yeah, 'cause that's pretty
Okay.
significant.
Yeah.
Yeah.
So,
I would have rather
It's doubled
seen it.
since I started.
I would have rather seen it climb slowly through the years
Mhm.
than woulda, shoulda, coulda.
Well, yeah, and it's just an outside perspective. I wasn't here, you know, the 10 years. So, you know, I'm looking at this as an outsider and I'm thinking, well, what is it that we did to keep it at that level for such a long period of time? Even if it were to increase from 2008, 1,000 a year, we would be up beyond
All right.
13,000.
let me explain to you too, that
So
we had
I'm
a,
just
excuse me,
curious.
we had a reserve, and that reserve was what we spent in order to keep that rate down. So our cost was higher, but we had a few $1 million in reserve, and what we did was, we were using that in hopes that in the next year or the following year, we would be
Or ship would
better
come in.
funded,
Whatever.
and so then we could give increases to the staff, then we could increase the insurance, and that way we could start to build up our reserve again. But we got hit with those couple of years of extremely high claims. So on top of that and the rising cost of healthcare, that's where we find ourselves.
We had a conversation when I was on the board too about using the center. If you, as employees, use the center as much as possible, you can keep your costs down. So if you, it's strictly your choice to do whatever, but you know, if you do whatever you can as having private insurance to control my costs, generic. I go to where I have to do. I shop it like I'm buying a car. It's not the same thing. Just because the doctor said to go here and hey, get my labs done doesn't mean crap to me because he's not paying the bill. So,
Another thing I struggle with, I would love to use a clinic. I have very young children. I can't bring them to the clinic
2
because
years
they're
old, I heard.
underage.
Yeah.
And I have to go to a pediatrician. So how does that benefit me?
Well, at some point they won't be under 2. Is that the deal?
Mhm.
Okay, so at some point you're going to get this cake on the other side from 2 to 16 or 18. That's going to make a huge difference. Having 4 children and paying it all the way through, I know exactly. But once they're past 2, if you're not on this and you don't go to the clinic with them when they become 4, 6, all the way up, you're going to be paying $55 co-fees and all this other crap anyways. But it's your choice, and that's what's great about it, is you can do whatever you wish. The only thing I can leave you with is being a board member for 8 years during the dark years, and now being on the hospital board, if you decided to do something with this, I would just look like a winner down there at the hospital because I'd get all these new customers. It'd be nice to serve on a board that made some money. But really, in all reality, researching this week and looking at it, the trend in healthcare, because no one knows what's going to happen now that President-elect Trump is coming into office, or the next person, what's going to happen to the Affordable Care Act. And it's really not all that affordable. So I'm not quite sure where healthcare is going in our country. I don't think anyone really knows. I mean, I'm worried, another 10 years I can get Medicare, if it's still there. I don't really know. So, I mean, to a certain degree, you should be very careful with the decisions that you make and build in maybe, getting it. You might be able to hold back for the next 10 years. I don't know. But in the real world, for me, it's just every year, 25, 30%, I just keep cutting it until at one time I had a $10,000 deductible. So I saved a month. I did learn a lesson. I had a son that was in a very bad motorcycle accident, almost killed him about 10 years ago. And my bills came in right about $300,000. Could have killed the kid because the helicopter ride was 85 grand. I could have bought one. But at the time, you don't care how much it costs. Save the kid. When you care is when the bills start coming back. Now, if it wasn't been for that, I had major medical at the time, and I was responsible for my insurance. I lost everything I had that yet. So, work as a group. Think about it, and just don't do anything drastic, because really the trend that I'm seeing is that big companies, to control expense, and it's all about, that's where you make your money in companies, is controlling your expense. Healthcare is a big one. You don't offer it, you trim the crap out of it, or you have your own center. So having your own center is controlling your costs as best you can and giving your employees the best cost you can, because you do want retention. Anytime one of you leave, costs the community money. I don't want that. So Diane will be up next, guys. If you have any other questions, just let me know. Thank you.
Thank you, Rob.
Thank you.
I'm Diane Bourne. I own Bourningale Insurance here in town. I've been in town 30 years and also ended up as a partner at HAS for 5 years before I retired. And I worked in the insurance industry. So my job here today as an outsider is to kind of let you know I feel your pain. The government's come in and controlled something that was like other enterprises. It was private enterprise. And if I could do a better job than you could do, I got your business. But the government's come in and said, you have to have health insurance. The government's come in and said, not only you have to have health insurance, and as large as you are, we're going to damn well tell you how you're going to have it, what you're going to do, when you're going to do it. How we're going to find you. Down to as low as 10 people as your employees. So what you're facing and what you're facing in the outside world is not really any different. You're just on a larger scale. The one thing you've done through the health trust and through having controlled a portion of the health insurance that they will talk to you later on, that's not my part of the presentation, is that how much they have controlled that you have not one incident wrong with you. I have diabetes. I could have diabetes, I could have heart troubles, I could have cancer, I could have 4 or 5 things. That has gone way down, which means the visits and the doctor visits have gone down. Now an insurance company that's taking care of your basic medical care will look at that and say, oh boy, oh boy, oh boy, you only have 2 carriers. We have no EP, or we have no HMO up here, so because we're out in the desert. And they think that we're out here where they can't control us, so we don't know what they get in the report. 65,000, not 5,000 when I came. But if we control how many times you go to the doctor, how many of the big incidents happen, that somebody finds out you have heart trouble before you have it, before you have the big one, which I had. They call it the widowmaker. If somebody controls that all before you have to go to that doctor and they get you in there soon enough, the cost of the claims goes down. And when that happens, Blue Cross or Doubleday or whoever's going to be the insurance company on it's going to go, whoopee, we want them. And they're going to give you a bigger cut than you have now. And this is what's going to control your insurance costs. It's simply a mathematical thing. No emotion, simply a mathematical thing. And you will be pleased that yeah, it went up in this year, but you will see it in years to come. And we can't depend upon thinking there's a better way because we don't know what's coming. Who knows what will happen to the Affordable Care Act? Who knows what little juicy thing they're going to come up with next that you have to do or not do. We don't know that. You don't want to give away the gift until you know you have something better. So if you feel there's something wrong, as Mr. Hobday said, don't rush into anything. Don't give away the golden goose until you know you got a better goose out there. Because we don't know what's coming. And I think what you'll see that we present here today is that things we are doing controlling. Now, we could have a big claim next year. Maybe, maybe not. But I can tell you, the larger the group, the healthier you are, the more you take care of yourself, the more work hours that you can work, the fact that you can get children in and yourselves in, and the wait time is around 5 to 10 minutes, as opposed to me, who comes back in the fall and makes my annual visit for my Medicare, where they ask me 3 questions and then say, do you remember what I asked you? And if I don't, I guess I'm going to the farm. I had to wait 3 months for that. And now they're not sure my thyroid's the right amount. So now I got to wait another 4 months to get in so they can do my blood test to see if I'm still dying or not dying. So I'm telling you, there is an advantage to what some of us old people put out there. And the thing that's surprising is that you have 5 different groups to choose your insurance rate from. That's unheard of. Back in the day, and I'm old, you had maybe 2, maybe 3. And we can't control the group. I mean, back when I was 65 and still working, I was in the maternity group, for Christ's sakes. Now, we all know I wasn't going to have a child at 65. I knew I wasn't going to have a child at 65, but I was in that group. You have 5 groups. You have employee only, spouse only, children only, 2+ children, spouse and children. If you take the highest category, it's at $19,341. On the next slide, I'm going to show you the national average is $20,742. That's for medical only, not including what you have in being able to go to the clinic. So you are saving from what's being paid out there on, now this is Kaiser that did this study. And they're the only, because they're a big agency, they can afford to do a study across the whole United States. We can go out there and find maybe Kingman's paying less or whoever, and gee, if they found somebody, let's find out about it. But I can tell you the chances of an insurance company having a good rate for you past 1 year are about nil to nothing. Because if the industry goes El Pupo the next year, then you're going to see a 40, 50, 100% increase. You have a chance to control that right now. And you have a chance to get continuing credits. Maybe Blue Cross Blue Shield will give you another 10% next year because you had good figures this year. And then, so your basic medical goes down, and now if you control the clinic, of which every year, now that you've paid everything, it's going to get better. And you are down the number, but if you have more numbers using it, it will pay off better also. And you get medication. God knows the medication's gone out of the market because of litigation, and there's some medication you can get there you don't even have to pay for it. And I can tell you as a heart attack victim, when I left AJS and retired, nobody wanted me. Blue Cross Blue Shield sucked me in 10 years ago for $1,800 a month. I am 12 years free of a heart attack, and they don't care. I had a heart attack 12 years ago. As far as they're concerned, I could still be paying $1,800 a month. Thank God I got to 65. But so I'm here to tell you, you have control over that. So then we go to the questions of what's happened. Well, the national, we've gone past the employee benefit. The national per person is $9,990. That's for the person only. Where for the person only here, you're paying $7,540. And I realize we're a smaller town, a smaller group, but you're also in an expensive area. Did you know that ministers in this city get hazardous pay because they're ministering in a desert? And they don't have the advantage of other ministers. And it happens in more than, I'm just using them as an example because I was on the board and I know that. So I'm just telling you that we pay more for doctors and things here. And again, the Affordable Care Act spending has grown, yes, but we've had things that have happened that we have no control over.
Diane, can I just jump in?
Yeah.
That $9,990 per person is medical only.
That's right.
And our amount for 70, whatever it is,
Includes
vision, dental, the whole 9
I
yards.
think our medical only was somewhere around 5, so we're almost half of what the national is. So there's not much to talk about that other than what you already know, is that our costs are going up. And we have a for-profit hospital here. Big difference. Big difference. Why they ship everybody else out to Las Vegas if you've got one foot in the grave, because they don't want their rates to go up due to the fact that they have a lot of people dying there. So I'm just here to tell you that there's a difference in what we have here, and that's the only hospital we have unless you go to Kingman or unless you go to Bullhead. So, yeah, they would love us to have to go to the emergency room because that's big bucks they get for that immediate care. And those are things that, as far as our growth in the town and the growth in the insurance industry, people have to make money. You have to make money in your business. You have to make money if you're an employee so you can afford your family. And the businesses have to also, so they find another way. Well, why has this happened? If you go to the next one, you'll see that private health insurance spending of $1.1 trillion, which is a 7.2% growth. I think that's low. I think you're going to find it going up to double digits, 10, 15, 20% every year. If you were out buying your own insurance, never mind what you can do by bargaining as a group. Hospital spending, 5.6%. I think you're going to see that go up. Because for a for-profit hospital, 5% is not worth having your doors open. They have to make way more money for that than all the investors or businesses that worth being open at 5%. Medicare, I look at that and I go, heck, I see on the internet, which we know is truthful, that they're going to take away my Medicare. They're going to take away my Medicare health insurance. They're going to take away my Social Security. So I don't know what to say to that. All I'm saying is if you're planning on retirement, don't plan on either. Build your retirement under what you control and the others traveling money. So, physicians and clinical services. If I have the government tell me that for this procedure, which I used to get $300 for, I'm going to get $100 for, I now got to see 3 times the number of people to come out the same. How am I going to do that? That means I'm going to have you in my office. I'm going to talk so fast to you that you can't understand what I'm saying. I'm going to put my arm around you, and I'm going to get you to the front door and tell you when to make your next appointment before you even know what the hell happened. And yes, and that's exactly what doctors have done to me, because they got that production out there. You go for a cold or things that are not needed by a specialist in your clinic, they're going to ask you, well, how many times have you had a cold? How many times has this happened? Maybe there's something else wrong. Maybe there's something else we want to discover. Now, I happen to have a everyday physician that is very good with me and talks to me about other things. But it's very difficult to go from that to a specialist. I mean, I could have another heart attack before I could see a heart doctor. And I know when I'm having one because I had it before. So even going into the hospital, they wouldn't talk to me if they thought I was having one. They might ship me to Vegas for that because that means I'm on my way out. So Medicaid expenditures, we can't control those. We can't control those. That's the whole position of what the government's going to decide to do. Retail prescription drugs. All I can say to you is litigation, litigation, litigation. If I decide to take the new experimental drug to make my brown spots go away, that's my business, and if I have my arm falls off because of it, it should be my problem, and I shouldn't be allowed to sue for it. And until that's corrected, you're going to pay my heart pills for $1,500 a month. And all I found out was when I was cutting meat one night at a dinner that Joe was at, and I got my hand up in the air like this, and I'm trying to cut a tenderloin steak, and it's running down my finger because they thinned my blood out so much that I couldn't stop the bleeding. And the next thing you know, I got a towel wrapped around it, and I'm walking around the table into the bathroom trying to put liquid skin on it so it'll stop so I can go back out and cut meat with it, because I can't get in to see a doctor to tell me, I could die in a car wreck, not a heart attack, because my blood is so thin. And for that you pay $1,500 a month for the pill. That's because of litigation. Again, that's something we can't control. But how we dispense it, how maybe the clinic can get things wholesale, better pricing, be able to do it for it, those are all things that can happen to you to control your insurance costs. All I'm saying to you, you are now the people out there that have this business that you're in, and you can make decisions. Just don't make them quickly without checking, and understand that it's a financial thing, not an emotional thing. I love teachers, my parents were teachers, all that. It's not picking on anybody, it's not being mean, it's a financial thing that you have to make that decision. And that's the basis you have to make. I did that in my business, and you have to do that now in the business that you're in. Thank you. And next up is Hal.
Hello, my name is Hal Christensen. We moved here in 1987. I had a daughter and a granddaughter go through the school system here. Unfortunately, they had to relocate out of state for different reasons. But I've been involved in finance and commercial real estate. Owned a small business here for a couple of years. I'm the new guy on the board. I came on the board last fall. So this is a lot of the stuff is new information to me also. But Diane had talked about the challenges that we're facing. I'm going to talk about some of the answers and solutions. So here is the next slide. Back in 2010, the trustees got an actuarial firm to do a study on what they could do, what would be the advantage of having an on-site or a near-site medical center for the employees here. So based on that, the trustees and the governing board tattooed all this. They decided to move into a proactive rather than a reactive situation. And a lot of people that move here to town, a lot of insurance programs are reactive. You don't feel well, you go to the doctor. The proactive model is more, what can I do to maintain some good health? So they opened up the center in 2012, and we were the first school district to come up with something like this. The center itself, they offer primary care, urgent care, minor emergency care. They also have the WOW program, which is a wellness program, which is very, very successful from what I understand from what Chrissy's told me. And the primary reason for that, people wanting to, as opposed to an in-house wellness center, a lot of people they're afraid of privacy. So the board decided, hey, we're going to go outside at this wellness center. We're going to contract it out. So that's what we did. So you can see here, since they opened in 2012, for the most part, we've met all the expectations. For this upcoming year, you can see 71% of the members, they've chosen to use the center as their primary care. There's some slides coming up here in a little bit. You can see how well they've performed. This culture of wellness, most of the employees have embraced that. The dependents, they're all buying into this because it just makes sense. The center itself, you can get there before school starts. You can get there after school ends. You can get there on Saturdays. So they've got really good times that you can see them. I learned something yesterday. That covered members enjoy much less absenteeism and presenteeism. So how many here know what presenteeism means? Okay. Well, I didn't know this till yesterday. That means like you go to work but you don't feel well. So you're still at work but you got something going on. So not being an insurance guy, I learned this from Dave yesterday. So presenteeism, new word for the day. So with that, I'm going to introduce Chrissy from the Wellness Center, and she's got some other people to introduce later on. And tell us how well we're doing. Thanks, Chrissy.
Hi, everybody. I'm Chrissy Carmack. I am the center manager. I'm also a family nurse practitioner. I'm actually going to introduce Stephanie Lewis for this next slide. She is from Turner. She came all the way out here from Kansas City. It's 30 degrees there, so she's enjoying the weather here. And she is our senior strategist. So she works on our wellness program side. She helps collect a lot of our data, helps with the wellness program and things like that. So I'm going to let her discuss the next slide with you.
Sure. Thank you, Chrissy, and thank you for having me. And I might not go home with this weather. I'm loving it. But Mary, you go to the next slide, please. There.
Yeah. Okay, you won't hear from Stephanie. Sorry. You'll hear from her later. I'll introduce her again. Okay, sorry. Some of the benefits to covered members. First of all, there's no out-of-pocket expense. So when you come to the center, there's no copay. What does that mean? More money in the teacher and support staff's pockets. Staffs don't have to pay anything when they come to the center. When you go to the outside doctor, which is still a choice, you can still keep your doctor in town. You do have to pay a $55 copay, which means more money out of your pocket. Primary care visits. We also have urgent care visits, that's your cough, cold, bladder infection. We also go a little bit further. We give IV fluids, we suture, things like that. We don't really do emergency room services, it's more urgent care. If someone is truly a chest pain, shortness of breath, if we triage that and feel it needs the ER, we will send you across the street to the ER. Or Laura and I have great relationships with the heart doctors in town, and I am able to get you guys over there the same day or next day usually if we need to. We also dispense a lot of generic drugs at the center at no cost to the patient. So you don't pay for that either. You also don't have to wait on the pharmacy to fill it. You don't have to go stand in line at the pharmacy, especially during snowbird season. That can take a while. And then take the med home. So you can go straight from the center with your med and go ahead and start your antibiotic, things like that. So that's a big benefit to you guys as well. We also offer a lot of immunizations. Now, We've actually expanded our immunizations lately too, because we have a lot of teachers that are traveling outside of the country on trips with their kids. So we have, per request, been able to keep some other immunizations in the center for those people as well, so you do not have to go to the outside for that. We also have the mom unit that comes to the parking lot at no cost. We also go out to the sites. We give flu shots, so you don't have to leave your classroom for very long. We also have the EAP. This is a great program. I'd have to rerun the data, but at one time, depression and anxiety was a top 5 diagnosis within the school district. So the EAP has been great. That, again, is no cost to you to get therapy appointments, counseling appointments, if you need it. We also have the wellness program. Whether you use the center or not for primary care, we do encourage you to use the wellness program. We are able to identify some chronic conditions through that. We can help you manage that at the center or send you back to your doctor to help them assist you with those conditions. We also have done a lot of extra things. We do a lot of healthy cooking classes after school. We do a lot of programs where you have a cardiologist come and talk to you guys. We've done where we sent sunscreen and chapsticks out to the school for sun safety. We have walking groups. We've also had dermatology come to the center and do free skin screenings for you guys. We also do the monthly newsletter. Colleen does a great job of getting that out to everybody with updates in it and recipes and things like that. This slide just shows you important objectives. When looking at establishing an on-site health clinic, kind of what they look at when they're trying to make this decision. So it was basically a survey, and as I'm not going to read every topic to you, but this is what employers looked at when they looked at the importance of starting an on-site clinic. Okay. I'm going to go back to Hal.
Yep, my turn again. Since I'm a numbers guy, I get to give you all the boring statistics. So again, very quickly, since they opened, the center opened in 2012, 40% increase nationwide in companies and entities that have opened facilities such like this. 2012, we had 484 covered lives. That's employees and dependents and everything else. That NEB, I found out that's the Northern Arizona Public Employee Benefit Trust in Flagstaff, city, county, college, and schools. They've got the clinics, Colorado River area schools down in Parker. They've got a clinic, Polk County, Florida. If you can see this, if we leave the slide up for a little bit. I know it's a lot of information on that YouTube, but there's a very good YouTube presentation on wellness centers or clinics that you can look at. Okay, so we can just leave that up there for now, Mary. Again, some other well-known businesses. The entire state of New Mexico and Missouri. There's cities in Kansas, Texas, Washington. Some of the major stores: Kohl's, General Mills, Frito-Lay, Toyota, Target, Steel, and many more. And there's a lot of vendors. There's Premise Health, QuadMed. Now this is like Cerner, who we use. Medcore, HealthStat, and many others. At this point, they figure there's at least 2,000 clinics like this, wellness centers like this, throughout the country. So now, more scintillating information from Christy, right? Right? Okay. That concludes my presentation for all.
Okay, well, welcome everyone. I am representing Cerner. Like I said, we are a managing partner. We're out of Kansas City, Missouri. I have a master's degree in nursing under family medicine. I obtained it from the University of Alabama in Birmingham about 2010. So I've been a nurse practitioner almost 7 years. I am board certified ANCC. I'm able to see 28 days and older. At the clinic, we do only see 2 and older, and that's per a Cerner regulation. I have some great people with me from Cerner today. As I had introduced Stephanie, I have Stephanie with me. She is our wellness strategist on the wellness side. She has a degree in community health, sports, exercise, which is a bachelor's degree. She's been with Cerner 10 years, so she's been with the company a long time, so I'm so glad that she came out. I also have Don Stubbs here. He is this gentleman. He'll be talking to you briefly on some of the slides. He is a director of population health at Cerner. How long have you been with Cerner now? 6 years. 6 years. And he has a finance degree, a business administration degree with a expertise in finance. And then I also have Brian Baker, sitting right here. Brian actually has an MA in education. He works for Cerner in the government side of Cerner. He has served in many positions in Missouri. He's been chairman of the Committee on Education, chairman of the Committee on Student Achievement and Finance, vice chair of Education Appropriations, and co-chair of the Joint Committee on Education. So he has an extensive education background. He joins us today as well. So I am first going to turn it over to Don and let him begin with his presentation. Thank you, Don.
Well, good afternoon, and thank you so much for having us. As Stephanie mentioned, we absolutely love your weather. It's just beautiful here. I'm actually from Florida. I'm here from Florida, so we have similar weather, but you don't have the humidity we have, so absolutely love it. First of all, I want to start off by saying thank you not only for having us, but for the partnership. We have thoroughly enjoyed having you as a partner. We appreciate you putting us in great hands as a healthcare team. I actually visited the health center today for the first time. Beautiful facility, excellent staff, the accommodations are great. So again, I appreciate the partnership. I appreciate the team that you have here. And I was able to sit in on this morning's meeting, and I absolutely love the passion. I love what you guys are doing for the teachers and others. So again, thank you so much for having us. I want to commend you. The other thing I want to commend you on is the vision to actually put this healthcare center in place. As we saw in the slides, there are about 2,000 on-site health centers from various vendors, and this is a pretty progressive thing. So I want to commend you for doing that. It's enormously successful. Cerner actually has 3 on-site health centers for our population, because when we had the actuaries come in and the others, the consultants from the HR folks like Aon and Hewitt and Mercer, they all touted these on-site health centers, how great they were. And so we actually put in 3 for our own population. So I know a lot of you don't probably understand who Cerner is, or you've probably heard that name Cerner in a hospital environment. But I wanted to just take just a few moments to kind of share with you just a little bit of background on who we are, because I know some of you are fairly new since this decision was made. So on this slide here, it talks about who Cerner is. This is kind of our little dashboard slide, if you will. So right now, we currently have about 22,000 employees scattered around 30 countries. And so we're a global company, and we face the same challenges that you face. How do you insure all these folks, and how do you reduce the cost of healthcare? So we feel your pain that we felt earlier on in rising, escalating healthcare costs. And so, because we too are a large employer. If you look at the slide again, just to give you a sense of comfort, our revenue is about $4.4 billion. And the only reason I share that is not to brag, but just to share with you that we're a stable company that has the same challenges, whether small or large. We will be around forever. We're not a small company that could go away anytime soon, so there's some stability there. One of the things that you also benefit from is that large number in the middle. So $4.9 billion in investment. So that's our R&D, that's our research and development number that we spend to fine-tune our solutions. I mentioned that Cerner has 3 on-site health centers for our population. We use those 3 on-site health centers as a living lab. We run computer programs, patient protocols, policies, procedures through those 3 on-site centers before we roll it out to the rest of the country. Right now, we have a little bit over 40 on-site health centers with Cerner. I didn't bring my NASCAR slide, but Frito-Lay that you saw here, Toyota, PNC Bank, Foxwood Casinos, those are all clients of Cerner that have on-site health centers and are doing rather well. A couple more quick numbers here. If you look at the number of physician users, those are physicians that actually use our EMR technology, electronic medical record technology. So Cerner is in that space as well. If you look at the landscape of hospitals across the U.S., between 30 to 40% of U.S. hospitals use Cerner's technology. The reason I want to share that is, think about the future. So if all of these providers, all of these hospitals, and all these global partners share our technology, can you imagine if we can connect all that data together? Just think about that for a second. So the quality of care will absolutely be better. So say you're injured in California. We can immediately have your medical information right there because of the width and breadth of Cerner. So that's just a little bit of a thought to leave you with. And so this is really quickly who we are. So again, we appreciate the partnership. Getting into why we're here, so we absolutely loved your vision, the vision of accomplishing this, creating a healthier population, and improving the quality of life. Now, we also want to talk about sustainable growth in communities. People are the foundation of the communities. And so by taking care of them and keeping them healthier, they will contribute to society positively. Well, how can we create a healthier person? Well, we have to change human behavior. We have to change the delivery of care. We have to change the environment, as well as the genetics and biology. So these are the things that we have to impact to change care and to change health. So I know we just kind of went over this slide of the reasons why folks are putting in on-site health centers. And you see all the percentages over there on the left side. That's all good reading. But take a look at some of these other stats. Look what employers are saying. 85% say that their organization generally perceives the clinic as a success. So there's a lot of wonderful testimonials when you listen to patients and why they're coming. I was actually down in Miami one time, and a lady came into the Publix, it's a supermarket. She came into our on-site health center, and she had chest pain. And it was like, well, why didn't you go to the hospital? Why didn't you go to the ER? She goes, no. I know the provider here. I trust her. She's been treating me for years. Forget the ER. I know I get good care here. And she bypassed the hospital to come to us because of that reason. It's a success. They know the providers, and we take care of them. So just a little testimonial there. But I'm not going to read all of this for you. Typically, we see a really nice return on investment. Those are some national averages. Again, there's a lot of work to be done to get those savings, but it's a combined effort. Your plan design, our care, incentives, all of these things will result in positive returns on investment. So there are beautiful stories from these employers. We can quickly go to the next one. So here's a problem, though, that we face, and the speakers before me touched on this. So we're spending money as a country in the wrong areas. Look at what we're spending on medical services. We're spending very little in healthy behaviors and very little in other categories. So we're definitely reactive here in that all we're doing is spending money on reactive care. What we want to do is transition over to the next part of the slide, which talks about where we should be spending our money. I'm sure you all heard that the only way to change health outcomes is to change behavior. Because things like drinking, smoking, overeating, no exercise, all of those behavioral items impact healthcare, as brought up earlier. So we want to change the mindset. We want to change the way people think, the culture. And you guys are to be commended because you're doing that. You have wellness services. You have great providers that provide a slew of services. And so you guys are actually doing this now, where you're changing human behaviors. And now you're going to see the outcomes for that. So this is where you were. If you take a look at the left side, you see that green line that's trending upward. This is where you spend. If we didn't do anything, this is where it would be. Now take a look at the blue bars. That's where you are now. So when we met several years ago, you all knew that that trend was happening. In fact, what was interesting, and now I have my notes here, what we found interesting, back in June 2009, your medical claims was 1.6 million. End of June 2010, 2.9 million. That was a 77% growth that you had in claims cost. And so your trend was not the greatest, but we all agreed upon at least a 10% increase year over year was going to happen. And so if we were to take out all those shock claims, we still, for the most part, can say, okay, with a 10% year over year, that's what your trend would have been. But look at the exciting news. Look at where you are now. That trend has been reduced. And the reason it's been reduced is what you've done here. Staying well, staying healthy, managing the cases, and getting well. So you've kind of switched from a care environment to a health environment, in that you're not only being reactive, but you're being proactive in terms of getting healthier. So what I'm going to do is actually get into the weeds a little bit in terms of the results from your on-site health center. And again, thank you so much.
All right. So this slide describes to you guys, most of us spend an average of 8 hours at work. So there's 24 hours in the day, and average we spend about 8.7 at work. Some of you are probably even longer. I know a lot of teachers grade papers at home. Some teachers and support staff have 2 and 3 jobs. So your work day may be even a lot longer than this 8.7 hours. But most of us spend time at work. We almost become a family at work. And it's just interesting what the average hours are on other things. Eating and drinking only an hour. Sometimes it feels like I eat a lot more. But so this just it's a really good slide to drive home that we do spend a lot of time at work. Next slide, please. So the trust, when they were giving the clinic too, they wanted to contain costs. They also wanted to give back to employees, and the health center is one way to do that. So you do have easier access. Most of the time we're able to get you in same day for an appointment. I know if I call for an appointment in town, it's very unlikely that I'm going to get in the same day. Probably 2-3 days for an urgent care visit. So you do end up at the higher cost urgent cares, and you do wait. Once again, we love our snowbirds, but if they're at the urgent cares too, getting med refills and things, you can sometimes wait 3-4 hours just to get your cough or cold addressed. We also want to be able to put more money back into the teacher and support staff's pockets. So once again, there's no cost at the center. You don't pay a copay, you don't pay for your meds, you don't pay for the EKG, you don't pay for the labs. The IV fluids, that can be a $500 charge at the ER. So our goal is to try to put more money back into your pocket so you can spend it on other things. We also have easy access to health records. We have the online portal where you're able to view your records if you want to, and your children's records as well. We also, our intention is to reduce absenteeism. We want to get you back into the classroom. We want you to be able to run over on a break or a planning period and be able to get back to class if you can. So we're trying to limit that time that you're out of work. We also have benefits programs that are coordinated with the clinic. We also hope, because we are more a quality care model, that you have improved communication with us. I know a lot of my patients, I don't even have to look at the charts anymore because I know people almost like their family. Chronic conditions are also managed better when you have an on-site health clinic. So ultimately, more time and energy to focus on their mission and prepare for tomorrow one student at a time is also our goal to align with you. As you know, the health center opened in May of 2012. We are staffed by myself, Laura, who's also a family nurse practitioner, and we do have 2 full-time medical assistants, Diane and Robert. This has been a pretty consistent staff the last 3 to 4 years. We've all been there. I'm going on 4, Diane on 5. So we've all been there consistently. Center hours are listed. We are open 6 days a week for 51 hours a week. We offer primary care, urgent care, and also your wellness program. So this slide just talks about, I did mention earlier, we are more quality driven. This means we want you to have a better experience. We're not driven by quantity. A lot of doctors, they've actually been forced to go into the quantity mode. They want to see how many patients they can see a day because that's more copays, it's more money. It's a business. It's not wrong of them. They need to make money. It's a business. We focus more on quality. We want to be more proactive, not reactive. We are open 6 days a week, 51 hours. We offer early morning and evenings. We even changed that in the last year to offer more afternoon appointments for the staff. We are focused more on wellness. We like to brag, we do have a less than 5 to 10 minute wait time. You're usually in the room and being seen within 5 to 10 minutes. That's also unheard of out in the real world, per se. We also offer, Laura and I do a lot of classes after hours. We do the flu shot clinics where we come on site. We do flu and pneumonia shots at your site so you don't have to leave the school. We also do the healthy cooking classes, walking groups, the skin screening days. Part of our quality model is longer appointment visits. So, for instance, a physical is 45 minutes. You may not need that whole time, but we want to dedicate that time to you because we're taking care of the whole person. We want to address any issues that you have during that visit. If we have an urgent care come in too, we might balance the two. It doesn't mean we're not going to see another patient during that time, but we want to give each person the time that they need in a visit. So we do have the longer appointment times to give you a better quality health experience. And we are also driven by quality metrics. So my company wants me and Laura to be more quality driven. We want to have better outcomes. So for instance, better diabetic control, better high blood pressure control. They don't want us to see 50 people a day. It's what quality. So employee utilization. As you can see on this slide, average unique patients. So please note this slide is from January to November of 16. This is the period that we're looking at. We had 781 unique visits. So this means if John Doe came in for one visit, he's a unique patient. If he came in for 6 visits, he's still one unique patient. So we had 781 unique patients. And as you can see, people are using the clinic. So the blue bar on the graph is the number of unique patients that have come into the center. And we have gradually went up, and then since 2014, it has been consistent at over 90%. So people are using the center. We would like more people to still use it, but people are using the center. The green bar is how many claim us as their primary care physician. We're a little down this year, but we also had a lot of turnover this past year. A lot of new people that are just filtering in, a lot of young people that haven't declared a medical home yet. Next slide, please. So total, what's our total visit count? So since the center opened in 2012, we have had a total of 22,456 visits. This is about an average of 4,491 visits a year. As you can see, it did climb, and then once again, 2014, we have kind of steadied out at over 90%.
Chrissy, is that including all the WOW appointments too?
This is. Okay, this would be including WOW. Good question. Next slide, please. Another thing, because we are more quality driven, we do look at patient satisfaction. The survey that we have you guys fill out, I do review those at least twice a month. We run a pretty high satisfaction rate. It is always around 95% and above. Recently, during this quarter, it was 98%. These are only a few of the comments that I imported into the slide deck. But for the most part, people are very happy with the experience that they have there at the clinic. Some of the suggestions in the past that we have gotten on the survey is extended hours and things like that, which we have tried to adjust for you guys based off that feedback. So some things we did want to highlight. If I could share every experience with you guys, I would love to, but we'd be here for hours. So just to give you an idea of some of the things the clinic has done since people are utilizing it. We had a 51-year-old, or 59, sorry, she probably liked that, I said 51. 59-year-old came in for a skin lesion on the nose. I decided to go ahead and do a full skin check and noticed a spot on her leg. Sent her to dermatology. I was very suspicious that it was a melanoma. It did end up being a stage 3 melanoma that was caught very early. She was very happy. She actually was very happy. She just was driving by, I believe, that day and decided to stop in and even get the nose checked. So that was something that, for her coming in and feeling comfortable to come in, and then us also knowing to go ahead and take the time to do a full skin check, we were able to catch that. There's also a 55-year-old came in for a sinus infection, was new to the district, was overweight, had a high blood pressure, was supposed to go to Disney World that weekend, and we really didn't want him in the car traveling with that high of a blood pressure. Ended up diagnosing this patient with high blood pressure. To date, this patient has lost over 51 pounds, is no longer on any medication, and has a normal blood pressure level. 55-year-old present with a fish hook, and actually I've seen this guy 2 or 3 times, so like I shared, kind of wondering how good he is at fishing. But I was able to remove the hook, did not have to go to the ER or urgent care and save that cost. So next slide, please. Also have another 58-year-old patient with obese, high blood pressure, high cholesterol. is on this amazing journey. So far, well, when I did the slide 65 pounds, I think now this patient's actually closer to the 80-pound loss, has kept it off for almost 2 years, is actually out hiking and kayaking now, pretty much off all medications, just very excited. And this person, I think, might share a story on down the line when her full success is achieved. 58-year-old came in with chest pain. As providers, we're able to kind of judge if we think it's a cardiac case or not. So we did what we could at the center. Felt it was still more a muscle issue, but Dr. Havasu or Dalul was able to see this patient right away. Saved that person an ER visit. Was just diagnosed with a muscle strain, and so it's nice to have those relationships in the community that we can get people over there instead of to the ER if we can say that. 17-year-old presented a couple times with sore throat. Laura decided to do a more intense workup, found out that this patient did have an atypical strep infection that we were able to finally treat successfully. And like I said, those are only a few of the stories. I'm sure there's many, many more out there that I could share with you. One thing I do want to share is, like I said, Laura and I every year are required to do a quality improvement goal. So we have to commit to try to improve something within our clinic with our patients. So the last year we decided that, high blood pressure, we had 82% that were elevated, and we really wanted to control that better. So we did more visits, we looked at medicines, we had people come in more frequently, did more diet, more education. The national benchmark was, as you can see in 14, only 52% of the population were in control. The national benchmark was 63%, so we were below that. So our patients were not as controlled as they should have been. By the end of the year, Laura and I were able to, along with our patients and the work that they did, we were able to get 82% in control. So we increased that by 30%, and we were actually above the national average. 72% was national benchmark. So that was very successful. This year we're working on diabetes. We're trying to get our diabetics more in control. So hopefully we'll have that data in the coming months, because that will end in December. So some health center highlights that I just want to pull out. First of all, we have a highly skilled, dedicated staff. Like I said, we've been a consistent staff. Around 70% claim us as their primary care provider. We had 26% increase in clinic visits when compared to 2014 and to 15. The successful completion of our quality improvement goal to improve high blood pressure. We also have more effective utilization of hours to accommodate you guys better. We also, Laura and I have expanded our services. We have started doing more skin biopsies. We're also doing allergy injections at the clinic, which is also a big thing for you guys, so you're not having to go to ENT every week. You're able to come to the center to do that. And then we also, collaborate with our wellness team to give you a monthly theme. We try to promote a wellness flyer at least, or a class, or a handout during that time, just to give you guys more tidbits on how to be proactive about your health. On the wellness side, we typically do a holiday nutrition class every year to get you prepared for the holidays, how to eat well, stay healthy during that time. We also, like I said, we did the sun safety, where we did skin screenings. We also distributed out the sunscreen and lip balms with a little flyer that gave you tips on how to avoid the sun. We also had Alliance that came in and presented the stress class to you guys during the holidays. We had Dr. Dalul that came and talked about heart health one month. In March, we had the WAVE nutrition class where the chef did the demonstration with you guys. And then, of course, the wellness program, very successful, which Stephanie's going to touch on that a little bit. I'm very proud of you guys, because out of all the health centers that Cerner manages, we have one of the most successful wellness programs in the country with a very high participation rate. But we did have over 600 appointments. We also, of course, do the flu clinic, where this year we gave over 300 shots at the clinic, or at the site. Next slide. So now I'm going to bring Stephanie back so she can touch on the wellness program a little bit.
I get to talk this time, right?
You do.
Okay. So what you're looking at here is what we call our strategic roadmap as the senior strategist for Lake Havasu. This is a working document. It shows what we've done since 2012, what we're currently doing, and what we will be doing. So in 2012, the Wellness Center and Wellness Program, WOW, was launched. That year, we really focused on the personal health assessment, also known as the PHA, and biometric screenings only. That was our primary focus. Over the last 4 years, we've really expanded the wellness program. As Chrissy mentioned, when I look at my book of business, average participation in wellness program is around 72%, 75%. You guys are at 91%, which is just unheard of. It's phenomenal.
It's because of Christy.
It's because of Chrissy.
I love her.
I love her too. But since 2012, we've really expanded the wellness program. As Chrissy mentioned, we've offered germ days, wellness classes, the wellness portal, we've offered challenges, there's interactive workshops in there, documents that you can go in and read. We try to push out, the sunscreen samples, lip balm samples around the holidays, recipes and sugar-free candy. We're going to just kind of going above and beyond, expanding that wellness program just beyond the PHA and lab biometrics. So at Cerner, our philosophy, you'll see at the top, is know, engage, manage. We know the population through the personal health assessment, the questionnaire, and their biometrics. We engage them through ongoing activities, so whether that's fitness challenges, workshops, wellness classes, walking clubs, challenges, and then we manage them through the on-site health center because, again, we want to reduce those overall costs. Next slide, please. This slide here really is a snapshot of the cohort group. So those members that have been in the WOW program from 2014 to 2016, and this is a phenomenal story. As you can see here, 75% of the cohorts have reduced their risk or have maintained, which means as they're aging, we would anticipate that they would be getting unhealthier. However, that is the opposite here. Through the wellness program and the on-site health center, your population is actually getting healthier or maintaining, which is a really good story to tell. 99 members, or 29%, had no change in high-at-risk conditions from 2014. And then 15% maintained at zero high-risk conditions, which, again, at my book of business, we really don't see that. So you guys are doing a really good job. Pat yourself on the back through your participation of the WOW program and utilizing your awesome on-site health center. I think at that, I'm going to turn it over to Dawn. Okay.
If it makes you feel any better, Susan Chen will do it.
Actually, Mary caught me.
Oh, it'd be great.
Now you replace the tea. Go to the health
That was not planned. Well, once again, before we concluded, we really want to, again, thank you for the partnership. And I've got to say, I have about 43 clients in my book of business. And I've got to tell you, you guys have one of the best programs. You saw the participation levels. You saw some of the the testimonials particularly. The engagement is huge here. So I want to commend you guys for not only taking this leap and being so progressive and offering this beautiful benefit, but the results are phenomenal. So the partnership has been good. I commend you guys for embracing it, and it shows wonderful results. One of the things that I was doing on the way here, I'm a bit of a finance nerd like my buddy in the back, and one of the things that I heard was something as simple as teacher absenteeism. The statistics actually share something interesting. Right now, a teacher misses on average about 11 days a year nationally. That is 5.3% of absenteeism in teachers. And so they miss on average about 11 days per year. And the cost when they miss 11 days on average nationally, that's about a $4 billion cost to pay for substitute teachers. So when you look at some of these results, you guys are not only saving individually, but you look at, you're moving the needle from a national basis. Yeah, that's just fantastic. So again, I really want to commend you guys for being progressive and for putting this in place and seeing the wonderful results. So again, it's not all us. A lot of this is on you as well. Your plan design, your incentives, your culture, and the way you've embraced this. So thank you again for the partnership. With that, I'm going to turn it back over to Chrissy. She wants to talk to you about some live testimonials. So thanks again.
Actually, I just wanted, we know you guys with the change in healthcare and things coming up, and us, of course, not knowing healthcare in the future. We really enjoy serving you guys at the health center. Cerner is, we are appreciative of the partnership with you guys, and we hope to continue that with you guys in the future. I just wanted to ask, is there anyone here that would like to share a special story about the health center, or, yes?
Sure, I'd love to. Well, my best friend is an MD here in town, who I've only seen for the past 20-some years. And so I had a really hard time committing to the center. But I did. And several times there's been incidents. My 17-year-old son, about 2 months ago, was extremely ill with the flu, throwing up. And my MD friend said to me, "You really probably need to take him to the ER. He needs fluids, Shannon." And she didn't do it there, because I'm like, our clinic, they don't do that. And if I go to the ER, it's going to be $5,000 for this. But here's my son, who I've never seen like this. So I thought, you know what, I'm going to call. Called the clinic. They said, "Hey, this is the situation." They said, "Bring him down right now." And within 30 minutes, she had a needle in him, fluids in him, and we went home that day with zero cost. As a mom, freaking out, thinking I have to take my son to the ER because he's never sick, and to see that. And I'm 100% supporter of the clinic, of you guys, everything you do. So.
My name's Amanda Fuentes, and I've had 20 years in the school district. I'm a retiree right now. And without getting overly dramatic, the Wellness Center in general, and Christy Carmack in particular, literally saved my life. 2 years ago, you know how you go to the Wellness Center for all the biometrics, and whoever knew about biometrics and bad cholesterol, good cholesterol, well, I've learned a lot. So all my things are coming out great, and the NP said, "You have an irregular heartbeat," and I'm like, "Yeah, so do a lot of people." And so they give me an EKG, and the nurse, it wasn't Chrissy, it was some other one, comes back in and said, "You have to go see a heart doctor right now." And I'm getting irritated, so I'm like, "You just said I'm in great shape. I mean, what's the matter?" "Nope, you have to go right now." So I go over and see the heart specialist, the well-known heart specialist in town, puts the Holter monitor on me. Next day says, "You're perfectly fine." Okay, fast forward 2 years, this year. Go back in, Chrissy Carmack does the wellness center thing again. She says, "You have great cholesterol, everything's perfect." She puts me on the EKG again. She says, "You have no regular heartbeat." I said, "You already know that." She goes, "You're going back to a heart specialist." And I'm irritated again. I'm like, "No, Chrissy, I'm not going back again. You guys keep sending me back there. My heart's okay." "No, you're going." So I did. I went back. I went to another heart specialist in town. And I go back for the results, and I'm feeling all good, thinking, yeah, this is just whatever. Found out I have severe aortic stenosis. She started scheduling all these tests, and I'm like, whoa. No, we're not doing that. So, nothing against Lake Havasu, but I want a second opinion. So I go to Phoenix. My son found me 2 of the best heart specialists, actually, in the state of Arizona. And the guy said, "No, I don't think it's going to come out like that on the ultrasound." Sure enough, came back home the next day and said, "Yep, you have severe aortic stenosis." So after doing a bunch of other testing, I'm scheduled to have heart surgery in Phoenix either this month or next month. They said if it did, I was asymptomatic. There were no symptoms except what Chrissy caught on the EKG. They said things could have started going down here very quickly, and I wouldn't be in the shape I am now. I would start having bad symptoms. I could die from them. Because I'm in such great shape, other than that, because I told the doctor, if I'm such great shape inside, with all the carotid artery, why am I have this bad? I have to have a replacement with a pig valve or a cow valve or something. So I have to have that replaced. But because everything else was good, thanks to you guys, the doctor said I'm a perfect candidate for a clinical trial, and so I'm probably going to save the EBT a lot of money because I think the doctors are paid for. But I want to thank you personally because I really believe you saved my life, so thank you.
Anybody else have any? And if people know Leslie, she's stubborn. You have to stay
I say something just real quick? This isn't necessarily just, it's not a story about the center, but I just want to say I've only been with the district for 1.5 years. I was a stay-at-home mom for 14 years prior to that. When my husband decided to drive a truck and somebody had to stay home and raise the kids, I got chosen. 14 years, my husband had insurance through his employer. It was free for him, and then it went to $10 a week for him to cover me alone. And this was 14 years ago. Was going to be $600 a week or a month, and then a $7,000 deductible. Well, I do accounting for a living. I pushed the pencil and I said that would be just bankruptcy, even if I ever have to make a claim. For 14 years, I was not insured. My children were not insured. We paid everything out of pocket. Insurance is ridiculous expensive, and everyone who has had it in the 14 years you've been here, man, I commend you. You're lucky. I returned to work specifically because I needed insurance. I'm old now. I wasn't old 15 years ago. I'm older now, and so I'm thinking I'm not going to be able to pay out of pocket anymore. I would like to say that I had no clue about the center. I didn't know anything about the school district. I didn't know much about anything other than how to do my job. And this center is a fantastic, wonderful benefit for me as personally. And I also pay, because of our wonderful Obamacare, I cover my 22-year-old, but she can go there and get for absolutely no cost. And the Medicare or medications that I take on a normal basis, I go there, they're free. I go see the doctor, I get right in. I was referred to a cardiologist very recently, sat for almost an hour waiting for my appointment. You don't have that at the center. You really do get great care, and I am so thrilled just to have health insurance, for one thing. And so when I heard about the costs here and everything, I was not surprised at all, because I already knew that's what it would cost. I kept checking with my husband. It was going to cost $1,000 a month just to cover me, and it went up to $10,000 deductible, which I did. And I say, they call that affordable? Affordable Care Act? Who is that affordable for? And since that meets the government standards, I'm not eligible for anything else. So it's that or nothing. So we chose nothing. Until I got this job. Thank you very much for hiring. I just want to say the Wellness Center is a wonderful benefit. And I like the fact that you can use it or not use it. It is your choice. And I choose to use it, and thank you very much for it.
We hope to continue to serve you guys, and if you have any feedback about the center, please relay it to me somehow in any way that you think we can improve our services. Thank you. Colleen. I will pass this over to Colleen Pankow, who sends you all the emails.
Here comes the bullying right off the start. Good afternoon. And for those of you who don't know me, as Chrissy just told you, my name is Colleen Pankow, and I'm a member of the Employee Benefit Trust. For those of you who do know me, Chrissy's little chair act was supposed to come just as I stepped up here, because I'd rather have a root canal be up here. On behalf of the EBT, I would like to thank you for coming to our presentation today and for staying through the entire presentation. We hope you walk away having had your question answered on why the EBT was created and what its primary responsibilities and goals are. We hope you have a better understanding of why we encourage everyone to use the Wellness Center for their primary and urgent care needs, especially whenever possible, because we do give the choice. The staff there are top-notch professionals who go above and beyond to provide not only medical care, but also the education to go help us achieve our mindset as being proactive rather than reactive. We hope you've learned, we hope we've helped you to better understand that the WOW program, which stands for Working on Wellness, that it was created to help us achieve that mindset and to show us how we can take responsibility in our own lives by simply making healthy changes in our everyday lives, whether it's dietary or exercising. The Wellness Center provides continued support and, continuing education and support by, and I think Chrissy named most of these, offering on-site flu clinics, dermatology days, nutrition days, seminars on how to maintain a healthy heart, stress management, hands-on cooking demonstrations, and also men's health issues, just to name a few. We hope the communication, and here's where the booze will come in, so just I'm gonna run over. Through the wellness newsletters and the emails, provide you another avenue to learn about different health subjects with information which may directly or even indirectly affect you or your loved ones or even friends. Lastly, from our family to yours, we wish you a safe, healthy, and happy holiday season. This concludes our presentation unless there were any other questions. Thank you.
Thank you.
One thing that we found that I thought was just such a good quote, and it is from Diane Douglas, who I'm sure you know is our superintendent of public schools for our state. When we promote the health and well-being of students, staff, classrooms, and schools, we are developing the environment which is also most conducive to the effective teaching and learning. I think that says it all. Thank you.
Thank you. Well, thank you, guys. I'm going to go ahead. Do we have any other announcements? Okay, then we can take a motion to adjourn.
I make a motion we adjourn.
Second.
Okay?
Nancy Arnone, Pat Rooney,
Yes.
Nicole Cohen,
Yes.
Roger Schmidt,
Yes.
Joe Navaretta.
Yes.
Thank you.
Thank you.